Buddy Sharp Show is a fun-filled podcast on the greatness of your hair and all its glory. From his travels experiencing the techniques and secrets of some of the most talented stylists in Western Europe, the United States of America, Canada, and of course the Caribbean islands, Buddy Sharp will share healthy hair tips and recipes on how you can enjoy the ease of keeping your hair healthy and glamorous all year round.
And the world is happy today. All right, guys, I am Buddy Sharp here in Dallas, and you can see my lovely co-host, Karen.
Hi, guys.
Oh, she's
Happy
talking
Tuesday.
already. All right, first of all, we're getting off the elevator here. All right, and we're getting off the elevator. This is too much fun. We have to have security to let us up to the
That's how
studio.
they roll around here.
That's how Jeff really rolls here. All right, so anyway, we get off the elevator, and here is Derek, our producer. All right, so he comes walking out, and he hands me this. Okay, ooh, I got it backwards. This is the Monet 30-second miracle, which is what I use on my Buddy Sharp luggage under these eyeballs. All right, and so he goes, I use this every day, and he goes,
Since last week, when I got here on accident
and he
last
said,
week.
I think I feel like I'm 6. And I said, oh my God, you're like in first grade. Oh. And so I told Derek, I said, well, why don't you show us a photo of, what you look like? Because we always get to see you back there in the
I'll give it to you in real form. You guys want to see what it did for me in literally 7 days?
Yeah.
Yeah, I want to see what you look like.
Hey, guys.
That was the before picture.
Okay, that is our fabulous friend Derek, who is a monster Dallas Stars fan.
Yeah.
And we would just want to put out our condolences to all you wonderful Stars fans. They got beat last night, but congratulations, Tampa Bay. Proud of you. Love the way you guys are tearing up the NHL. All right. I just introduced my friend Karen, my bride, my lovely, Okay. What do you think about this hairdo that I put on her this morning? Huh?
This was my idea right here.
Is this Sharon Tate
Sharon Tate.
Well, I mean, this is before the horrible event.
That's,
But anyway, she's got that whole retro look. But anyway,
he doesn't mean anything.
When she was asking me this morning, how should I wear my hair? How should I wear my hair? I went, oh, I got this. I got it. Because A, I'm too lazy to curl it. But it looks good. What do you think?
Yeah,
You like it?
I do.
You're ready for me to get on with the show,
Yes,
right?
we have a very important guest here. We need to introduce him.
Okay,
Let's get
we
going.
have this is a first for us. We have got a special guest. All right, let me see if I can remember all the absolute credentials this guy has. All right, A, renowned U.S. cosmetic surgeon. He does the untouched procedures, which means that I was telling Derek over here this morning, he goes, what's that mean? What does that mean? It means that when you let's say you get an eye lift, or if you get a facelift, us professionals, when you come in to get your hair done, we can see your little scars. All right, they're usually about that big. All right, I'm kind of making that up. But anyway, with this untouched version of what he does, it's incredible. And he's been doing cosmetic surgery for right at 20 years. Mm-hmm. So he's a little younger than I am. Hate him. But anyway, guys, I would like to, without any more hesitation, Dr. Doohi Lee of Plano, Texas, cosmetic genius.
Yes, he
All right,
is.
there he is. Oh, all right,
Dr. Lee.
let's give him a hand.
Thank you so
We're
much.
excited to
Thank
have
you.
you.
It's great to be here. Oh, please, please.
There you go. All right, I got a question.
Sure.
You do shows here at the all-inclusive, fabulous compound.
Exactly.
Yours is about cosmetic surgery.
Well, no, cosmetic surgery is part of it. So it's done with my partner, Jens Johnson, who is the executive director of Women's Network, and that's how I met her. And because of all the things that we're going through with the pandemic and the coronavirus and lockdowns, there's so many people going through trials and tribulations, and so I came up with an idea of let's do something together that talks about the range of things that people go through. So we came up with the title called Love and Health in America. So it covers the health aspects as well as the emotional and spiritual aspects. So we cover a lot of different points, and I guess the main focus is some health concept that I developed about 6 years ago called the Diamond Matrix. And this is a 3-dimensional construct that looks at 7 different points that are essential for creating and maintaining optimal health. And aesthetics is one of them, so I put that on the top. But other points are like healthy nutrition, lifestyle, emotional health, regenerative medicine, brain health, and aesthetics and cosmetics. And in the middle of that 3-dimensional diamond, in the center is, drum roll, sexual health. Because, optimized sex and sexual health, it really is required to have all those components working properly, and vice versa.
That's true.
Yeah,
Okay,
so that's what the fun is in the center.
All right, you guys can see my brain
A little perverted brain.
spinning out of control here. That when we were visiting last week out in the hallway, I was asking him, okay, we know that with everything that's going on in the world today, with the stress, with all of the fatigue, all the staying home, all the crazy crap, and you are just really popping out the platelet-rich plasma, the PRP, to regrow hair.
Right.
And I asked Dr. Lee, and I said, does the PRP still need to be nourished? And the answer was,
of course. Oh,
yes.
Yeah.
So that's why, like with our Monate collagen and our Monate, the Capixel that is in our IRT spray, it goes hand in hand. But I, being a beauty operator with a lovely bride, does she not look great today?
Yes. She always looks great.
Yeah. So I was asking her, I said, how would we encompass you coming in here?
Yeah.
Because I don't know how the PRP injections, I don't know where it
comes from and things
I know
like
it
that.
comes from the adipose tissue, which I cheated and Googled that. But how does it work? How do you get the fat into PRP and then into my head?
Yeah.
Okay. All right. So since you brought that up, let's kind of go through the little aspects of what I call biological medicine. That falls into the area of regenerative medicine, my little diamond. And so in that area, I mean, that's a huge field, including hormone replacements and all this kind of stuff. But in that area, PRP, platelet-rich plasma, actually comes from the blood. We actually take out about 10, 20, sometimes 60 cc's of blood, and we concentrate that, and we actually take the platelets out of that blood from the serum. And platelets just normally are the cells that help you clot. If you cut yourself, eventually you clot, or eventually you die, but eventually you clot. But those are platelets are the ones that actually, do start that whole cascade of clotting. But what's interesting is when you take it out and concentrate it and inject it into, tissue, joints, and all these different places, it actually has almost a stem cell-like effect. They're not stem cells, but they actually incite regenerative and growth type of reaction, actually recruiting stem cells, growth factors, etc. So that's why a lot of people are using PRP in the scalp to start that whole regenerative process.
Okay,
I was going to ask, can it regenerate your hair?
Yeah.
Okay.
It depends on the length of how much you've been bald or lost hair. So everybody's a little different. So if people are interested in this, they need to go to a practitioner who understands the biology of hair and understands scalp, because there are many reasons why you lose hair. I mean, you mentioned stress. Well, stress is one of them. It's a big one.
Stress and there's surgeries, chemotherapies,
and
all
even
that
things
stuff.
like fungus, infections.
Yeah.
Some people, you have genetic predisposition, sometimes hormones like bad thyroid, low thyroid status. There are a lot of different reasons. So you need to kind of figure that out first. Make sure you start to correct that and even that out. Because if you don't want to have a bad playing field. Because you can do all these things. But let's say some people go and actually have hair transplant. That's a very expensive procedure. But if biologically you're not set up for it, you're going to waste all that money because all the hair is going to fall out.
It's going to fall out.
Yeah.
And also, even with the hair transplants, the PRP transplants, you still have to nourish the new hair that comes in. And that is where you and I were talking that the collagen and the IRT spray comes into play, because the collagen is going to make the hair a little bit more elastic.
Exactly.
And the IRT is going to stimulate growth of the follicle. But with certain areas, and now this I do know, is that the front with the alopecia is completely different than the effluvium alopecia that we have in the crown. And you were telling me that, and this scared the bejeebus out of me, is that you do injections.
I want to hear about that.
Into the scalp. And it scared me.
Okay, let me really scare you this time, because you mentioned about fat, right? So that takes us into the next level of regenerative medicine or biological treatment, which is stem cells. That's what you're talking about. Actually, when you go and do fat harvesting, believe it or not, fat contains the highest concentration of stem cells in our body.
Get out of here.
We do liposuction every day and throw away billions of cells, but that's where most of the stem cells live.
All right, I am never having liposuction. I just want you guys to know I'm never having
liposuction. You got to take the stem cells out.
Oh,
okay?
So
I'm going to take liposuction and
I brought some toys because you talked about, these are my little toys. We talked about doing this, and so this is not really a liposuction tool, but I use this for breast surgery. But it looked good. It looked interesting, so I brought it.
You use that for breast surgery?
Don't ask me.
Okay.
They're
I don't want to
yank
go through all the
those
details.
off your lap.
Derek, did you see that?
So this is one of the cannulas I actually use to suck the fat out of people. See this big thing here, and you can get it all out, and then you concentrate it. And there's a whole device that I use to take the stem cells out.
Can I hire really fat people for you to use that on?
Yes, of course. I would love to take
Oh my God, that is going to be so
And then
good.
this is a little gizmo that actually dissects tissue to create a plane. It's a little gizmo. I don't know what name for it, but it's a gizmo. And
Looks
then
like a little pitchfork.
This is my primary anesthesia
I have one of those.
anesthesia technique. So you get a little and actually it works very fast. And you wake up with a little headache, but it's not too bad.
Well, that is
a little
awful.
hematoma headache, right?
Yeah. Okay.
But anyway, all kidding aside, so once you actually do this, everything goes into a little syringe like this. And a tiny little 30 gauge needle, so it really doesn't hurt much at all. So that's the real tool I use for the scalp. Some people actually think that I use this to go into the brain, but it's not a good idea. I tried that a couple of times and didn't get good results.
Well, after seeing that small needle, I'm not afraid, but I can
hardly see it.
I got me some hair, so I'm good.
Great. You don't need anything from me.
I do have good hair. I do. And look at my alfalfa.
Yeah, exactly.
Going on. Yeah, but it does feel good.
Yeah, so anyway, the stem cells are really effective because they're a much higher level of biological effectiveness than PRP.
Right.
They're the real cells. So you actually inject the stem cells right at the level of the hair roots. Right?
Oh, in the dermis layer.
In the deep dermis area. Yeah, exactly. You inject that. And then you can follow that up. What I would do is with your product, because I understand some of the science of your product, is prepare the scalp, for maybe several weeks, a month, and then do the stem cell and follow that up with additional, continuous treatment.
The nourishment.
Yeah,
okay, so
I
we
think
need to...
because you want to prepare the bed, so to speak, because you're planting something.
Right, so we need to encourage people to eliminate all the debris off their scalp for 6 weeks, 7 weeks.
Yeah, minimum 4 weeks.
And then
I think
when they're coming in and getting this kind of application,
Sure.
for lack of my hairdressing knowledge, I'm still looking at the big old needle
This
thing.
thing, big needle thing, right? This one? Yeah.
Wow.
That's a little
This
baby
is the fun
fork
one.
on the end. It looks like a little fondue
Wow.
stick.
Yeah, this actually, I've done that. No.
That's fun.
Great idea.
Okay, all right.
Yeah, so anyway, the stem cells go in and actually start replicating and regenerating the actual cells in the follicles.
Right.
And that's what they do. So that's why it's so important to create a nice environment.
How often do you
with
have
the
to do
stem
it?
cells. Generally, stem cells, you do it once.
Once?
Yeah,
One time?
PRP, you need to do it 3 times.
Oh, okay.
Yeah,
got it.
yeah. But stem cells generally once, maybe if they don't take very well, maybe repeat it in about 6 months or something like that. But it takes a long time for the hair follicles to continue.
Money just launched a wellness program, but then about 1.5 years ago, they launched skincare.
Yeah.
All right. How does this encourage these skincare? All right, so how does it encourage the skin to be more elastic? How does it get rid of wrinkles? Is this something that we can
Oh, definitely.
do a more determined effect on?
Well, I think you're if you're using a product, like Monette and from the skincare line, the biological process will actually prepare the skin by creating a healthy environment at a deeper level.
Okay.
From the dermis to the subdermal layer, make that healthier and thicker. And then even the epidermis, where the stratum corneum lives, as the skin becomes healthier, you get faster turnover.
Yeah.
And then you get newer skin faster, right?
Exactly.
And then when you use your product to actually nourish that, you're actually helping the skin from both sides, from the deeper layer as well as the top. So I think it'd be a great combination to do both.
Okay. Everything that he just said, I knew that.
Of course. I didn't have to be here.
Oh my God, I know, right?
well, welcome to your world. Okay.
My world, as I like
All
to
right.
say.
Yeah.
This is only a 30-minute podcast show.
Is that
I like
right?
to call it a show.
Show.
Because
It's
it
a
feels
show.
like me and Johnny Carson were kind of like this. Yeah.
It's a show.
All right. What is any of the services or any of the procedures that you do, are any of them permanent?
Well, nothing's permanent. The only thing permanent is, aging. That's what I call it. Unfortunately, that's the only thing we live with. Is aging is permanent. I guess
Getting old.
Death is
death
permanent. Once you get that,
taxes.
that's
Yeah.
permanent.
Can't
But
do
while
that.
we're alive, aging is permanent. So everything we do, all we're doing is really enhancing and optimizing. I call it optimizing.
Right.
Because each person's different, and one procedure that's good for one person doesn't necessarily fit with somebody else. But when you actually do an aesthetic assessment, then my whole goal is to really, how can I make this one person look the best as possible? And that includes all the health, internal health. So that's the anti-aging process is great, because if you're not healthy, I have some patients come in once in a while for Botox, and I look at their skin. It's like, okay, I'm doing Botox, but the skin is so unhealthy. I can just tell.
Right. Okay.
So I start talking to them about health and nutrition and vitamins, and they look at me like, I came here for Botox.
All right. See, I have a question on that.
Because if you're not healthy inside,
Yeah.
I can't do much
All
for
right,
you.
Karen is religious
Yeah.
about cleansing her face at night, cleansing her face in the morning, which, I'm guilty. I will do it in
Well,
the morning and I'm a
We're
guy.
guys. Come on.
we're-
Yeah, I don't do that.
Knuckleheads we are. Okay, so when
We're guys.
ladies take care of their skin,
yeah.
and all of you out there, remember, take care of what the good Lord gave you.
Yes.
All right? How important is that?
That is critically important. Actually, guys really need to learn from all the women what they do. But it's really critical, because skin is the largest organ in your body. And so especially the face, so that's the area that we look at all the time.
Right.
But if you're actually healthy internally, that nourishes the skin itself. Increase blood flow.
Right.
Take away all the toxins. Interacts with all the free radicals. We get hit with sunlight all the time. Right. So all those kind of things have to happen to actually set up the basis for health in your skin. And then just like I was talking about, PRP and stem cells in the face. Along with your products for enhancing the skin, critical. I mean, when you actually cleanse your skin, allows the pores to open up, and then you put your good products that actually help and heal the skin from the daily damage. I mean, that's critical to staying young.
Well, see,
staying young.
Monet, with his anti-aging philosophy, they, Jamie Ross, Senior Louise, Ray, and Stewart, they're always preaching to us about the dysfunction of free radicals.
Yes.
And for those of us,
Except you.
except for me, who aren't sure, how are free radicals produced? And the anti-aging process helps to eliminate them. But if we don't know how they're produced, how does it make sense to eliminate? It doesn't matter what you do, as long as you do something. But the first thing we have to know is, how do free radicals get?
Well, free radicals are produced just from a pure biological function. I mean, if you literally lock yourself in a dark room and not get exposed to the sunlight, just the biology of what happens inside the body produces free radicals. This is part of it.
Okay.
So not all free radicals are necessarily bad. I mean, these actually things go and do. There are certain biological functions that free radicals do. But what happens is that when you have too much of them, from the foods we eat, all the bad stuff, we're talking about the trans fats and all those different toxins and the pollutions and heavy metals that we eat, and then of course the sunlight. We live in the sun belt, so that's always a concern. So when you actually have this radiation and other things that actually attacks the cells, attacks the DNA, different molecules, and different ions get taken out, those are the free radicals that actually go and travel, and their whole purpose is to not be what they are.
Right.
I'm a free radical. I don't want to be free radical. I want to find something and not be radical. So
okay.
they'll literally hit any molecule,
Okay,
be
I
it
got you.
DNA, be it protein.
So free radicals
and they'll
are
hit that molecule and basically cause a chain reaction to make that protein or DNA break up.
yeah. So
And
free
those
radicals are basically thugs that go
Thugs,
out there
exactly.
and attack.
But they want to become nice. Okay,
Aw,
so they
they
attack
wanna-
something.
oh, they
become
lie to
something
you.
else. Yeah, exactly. So that's how cancer starts. That's how disease starts. A lot of the things with free radicals.
All right,
So that's why we talk about the
okay,
antioxidants. When you have the antioxidants go there and help neutralize the free radicals, so they become nice again. So they don't actually go and attack your
Makes
body.
total sense to me
Yeah.
now.
Does he not look? You are so much more handsome than Dr. Because. I almost
Dr.
said.
Because.
I almost. I almost
you're
said.
too kind. You're too kind.
No. You do. Have you thought about taking this to a different level?
Well, I need more hair first. I mean,
right.
I think the producer wanted to put some stuff on my head too.
Derek.
For the
Derek.
light reflection.
Hey,
So
Derek,
I'm with the perfect company right here.
Hey,
so.
Derek, you think we ought to give him some of this 30-second miracle stuff to use on top of his head?
It's something,
You should,
whatever.
you should
Yeah.
try to give him some of the
There you
eye
go.
stuff. The eye stuff is great.
That does. It looks awesome.
Because I look like a Gerber baby right now, right?
Oh,
With
you know,
glasses on. Because I have no hair.
I was telling the people out in the hallway how much we look alike.
Right, exactly. Yeah, definitely.
Yeah.
Yeah.
The glasses throw people off, but I got readers.
Okay, can I ask a question?
All right, go ahead.
Okay, so I know I want to know, and probably a lot of women want to know, what are some of the trends or the top procedures that you do cosmetically?
Sure. So there has been quite a sort of a revolution in terms of what people get done over the past 5 years, especially past 5 years. So before, it used to be all surgery. Most people,
like facelift.
well, facelift, breast surgery, breast lift, and tummy tuck, liposuction, all kinds of stuff, pretty heavy duty stuff. But there's been so much more advances in non-surgical techniques, like the skincare products you're talking about,
Right.
And
Are they more
lasers?
Is the skincare techniques more topical or the internal?
More topical. But the fact that your company is actually marrying the internal supplements with the topical, that's the perfect combination. That's my theory of inside outside health.
Right.
You have to take care of the inside as a foundation, then you can make the outside look nice, right?
Yeah.
It's like building a house. I always tell
Yeah.
my patients, listen, when you build a house, you gotta have a good foundation. If your foundation sucks, house falls down. I mean, seriously, right? It doesn't matter what kind of paint job you do.
Yeah, it sounds like
if
you
the
live out
foundation's
by.
not there, it's gonna fall
No,
down.
it sounds like you live out by where we do, and all the foundations are like crap.
Yeah, exactly.
And I got this
Yeah.
big.
I know, and I
crap
tell the
coming
patients,
down the
well,
wall.
this is through
Yeah.
the foundation. When I do fillers, when I do fat transfer, when I do all these things, I am setting your foundation. Then we can do lasers and Botox and all this stuff to make your skin look nice and healthier. You
Right.
know? But you have to have a good foundation. Otherwise, there's really very little anybody can do to really make your skin look good. So that's where the both internal part and all some of the non-surgical things we do. So more and more people are doing less surgery. Even facelift, I've graduated a lot more into something called thread lift. You're actually using tiny little threads to lift and reposition your skin rather than making a huge incision to a full facelift.
Does that leave the incision smaller?
You can't see the incision. It's done through a tiny little needle hole,
Yeah.
so there's no
Very
scar.
cool.
Yeah,
Okay.
it takes about 30 minutes.
30 minutes?
Virtually painless, and it's fantastic.
You
results.
must be a hairdresser.
I've never done that.
Yeah. Well,
I'll have to try it.
I've never taken thread to people's jawlines either.
Yeah. So
Really?
that's
30 minutes?
30 minutes, and really is very painless, and you literally get instantaneous change. I mean, it's not for everybody, obviously. You have to select the right patient.
But again, that's not something that's going to be permanent.
Right, it lasts about a year, and
Okay.
depending on how fast your body metabolizes it. And then, but the thing is, as the thread melts, you get more and more collagen formation. So your skin becomes thicker, and then lifting effect starts to last longer.
Oh.
But just really is great for people who are in transition,
Right.
from young to middle part where you don't really need a facelift, but you could use some help.
A little tightening.
A little tightening, little elevation,
Yeah.
a little repositioning,
Yeah, let me
and
look.
that's perfect.
Oh,
you
you're
know. That's a
fabulous.
great technique for that.
All right, everybody.
And then full facelift and things like this.
I know we're getting tons of comments on Karen's hair, but what do you think about my monkey jaw? I'm going to get those stretched out. Yeah. And we were talking about it. He's like, oh no, we could do that with a
Yeah, the little
face
thread,
thing
lift,
here.
change, and whatever,
And the
yeah.
next thing you know, I'm going to look like the Joker.
Hey,
And, yeah.
no.
So,
No.
Not with me.
right. Well, oh my God, it's been 25 minutes.
Oh, is it really?
Derek,
Okay.
how are we doing on time?
Oh, we're good.
Oh, we're good. Okay.
Okay, I got
So
one
that's
more.
where some of that untouched look comes in, because you mentioned that in the beginning, which was I appreciate that. But that is really my philosophy, is to really make people look like nothing's been done to them, but they walk out and they look they're optimized. You know? So I always tell my patients, I don't want my name on your face.
No.
And it's like, well, what does that mean? It's like, you know,
makes sense.
if I do something that's fantastic, all your friends are going to say, wow, what are you doing? You look great. If I do something really weird, they're
You're
going
going
to
to tell everybody.
who did you go to?
Oh, yeah, I'm going to
Yeah.
tell everybody.
Oh, Dr. Lee. It's like, oh, yeah, sure.
Oh, yeah.
Yeah.
Now,
That's the last thing that was.
All right, at your clinic
Yeah.
or at your office, now, do the ladies and gentlemen, do they have to be put under?
There's certain procedures that they do, but I'd say about 75-80% of my procedures will be awake.
Nice.
Yeah. I mean, if you have surgery, you have to be, obviously. You know, but all the non-surgical procedures, you're totally awake.
Got it.
So anywhere from fillers to Botox to the PC. I keep saying PCP.
It's not.
PRP.
I say it every time.
No,
PRP.
PCP was something that, back in the 60s you
Yeah,
learned.
they
about.
really
I
they
did
had a
not.
good time with
No, I
that.
did
yeah,
not.
so- okay.
Well, I think we have bothered this man long enough.
No, I
Oh
was
no,
having
it
a
was.
good time.
I had a great time. Thank you.
Oh, and to be honest with you guys, I learned so
did
much
too.
today. And A, I love the hair. B, Dr. Lee, thank you.
Thank you so much.
This
Pleasure.
was-
I
Well,
really
so-
appreciate
awesome.
you having me on.
So, Derek, do you have his website?
Check
Okay.
the description. It's always in the description.
Oh, it's in the
Okay,
description.
it's in the
but Dr. Lee can tell
description.
Yeah, it's advsurgicalarts.com.
them. Okay.
Like ADV is advanced surgical
And so
arts.
it's a, what is the name of your?
Yeah, advanced surgical arts.
Got it.
Oh, I like that.
Yeah, in Plano.
And it's in Plano.
Yeah.
Okay.
Well, I just wanted to tell you guys today was awesome. And I just wanted to thank Dr. Lee for coming by, and of course, the young and
Young
fabulous
Gerber baby.
Gerber baby
Gerber
back
baby,
here
yes.
behind the screen. Thank you. And just remember that today was awesome. Every day can be awesome. And this is my friend Dr. Lee, my beautiful bride Karen, and I'm Buddy Sharp. I'm
See
out
y'all
of
next
here.
week.
And
Thank
remember,
you, Dr. Lee, for
Oh, my
coming.
pleasure. Thank you so
always
much.
stay self-employed, and remember, guys, we got this. I'm Buddy Sharp. Bye, guys.
Bye, everybody.
Thanks for watching this week's episode of The Buddy Sharp Show. If you want to learn more about the guest or products we talked about today, please check the description below. As always, you can find us on the web at buddysharp.com. We'll see you next week with a brand new episode.